from Living Goods, Chuck Slaughter.
Deep breath. I'm a father of 3 boys. 4 years ago, in the dark of night, my youngest son, only 4 years old at the time, fell mysteriously ill. We did what most people would do where I live. We called in vice nurse. She promptly identified his symptoms as grave and sent us hurrying to the emergency room. There he was diagnosed with a condition that's deadly if ignored, but easily treatable if caught in time. If my son were born in rural Uganda, he would not be with us today. So why shouldn't all children have access to the same care as mine? The 20 richest countries spend an average of $6,000 a year per person on health care. The 20 poorest spend less than $40. But here's what I really don't get. Why in so many poor countries are the poorest people in the healthcare system, village health workers, expected to volunteer without pay? Is that right? Is it sustainable? No one ever suggests that the Minister's of Finance should work for free. At Living Goods, we found a way to empower my heroes, these community health workers, to make a difference and make a living. Living Goods and our amazing partners have proved that this model reduces child deaths by 25%. But most importantly, we're delivering this service at a value that is feasible even in low resource settings and scalable, costing less than $2 a year per person we reach. Our courageous health workers don't care for their neighbors just to make a living, but isn't it obvious they can't do it without making a living? It turns out that the right thing and the smart thing happen to be the same thing. Now, we're committed to spread this idea far and wide like a virtuous contagion. By the end of this year, Living Goods and our partners will serve a population of 5 million. That's greater than the population of Ireland, but it's just a start. In 10 years, we want to multiply that tenfold and reach 50 million. You know, there's a myth about entrepreneurs that they conjure miraculous new models from whole cloth. In truth, we're all watchers, we're learners, able adapters, clever combiners. We build on and amplify the work and ideas of others. And Living Goods' impact is only possible because of the inspiration that we draw from other innovators, partners, and funders, many of them members of the Skoll tribe, like BRAC, SIF, Partners in Health, Medic Mobile, and yes, even Avon, all the way back to the first midwife who reached out to help a neighbor in a moment of need. Now it's time to pay it forward. At Living Goods, our vision of the path to large-scale change on the scale of the problem, demands being the source of inspiration to others. We will do whatever it takes to help health workers around the world and the institutions that support them learn from us, just as we will keep learning from them. Let ours be the generation that refuses to accept that whether a child lives or dies is determined solely by the postcode that they are born in. So I thank you all. I'm so humbled to stand alongside these 5 absolutely amazing fellow honorees. And I'm deeply honored and grateful to join the Skoll community of these inspiring innovators spreading world-changing ideas far and wide. Thank you so much.